Developing state-level programs to care for complex populations. PTAC backs 2 new alternative payment models, and a cancer gene profiling test may open doors to new targeted therapies. Welcome to This Week in Managed Care. I'm Laura Jost. The National Governors Association has released a roadmap to guide states to establish complex care programs. The roadmap comes after 4 years of working with 10 states and Puerto Rico as they implemented their own state-level solutions that target high-need, high-cost patients who are high utilizers of the emergency department and other costly settings of care. NGA identified 4 components key to building and implementing a complex care program. Develop internal resources, build stakeholder partnerships, and conduct environmental scans. Build a theory of the case, identify the target population, and design a way to track and evaluate the approach. Develop and implement a delivery and payment model, and track implementation, evaluate the program, and communicate the findings. NGA's program was born out of successful programs already in place across the country, such as those being run by Hennepin Health in Minnesota and the Camden Coalition of Healthcare Providers in New Jersey. Last year, Renee Murray of the Camden Coalition explained the hotspotting technique the organization was using to identify and care for complex patients.
Traditional medicine is more so breaking people into silos or segments, whether you're living with diabetes or living with congestive heart failure or COPD or end-stage renal disease. That's how our healthcare system makes interventions or treats people or has conversations with people in those silos. So if you are living with diabetes, I'm going to talk to you about diet and blood sugar and exercise and that management. And the shift is, in the paradigm that we are working out of, the hot spotting paradigm is, it's looking at complex patients in complex systems. So the shift is, we're not just segmenting the disease, we are embracing multiple diseases that the person may be living with. The person might be living with COPD, congestive heart failure, unmanaged schizophrenia, and depression, in addition to experiencing homelessness. The hotspotting paradigm is shifting, saying we're looking at the holistic approach. We're looking at the whole entire picture of the patient, and we're focusing on all of it. We're not just going to laser in on one disease state. We're taking everything that's making up this person into account, and we're going to figure out how do we plug them into a complex system, but with resources that already exist. So the main difference is the shift of not being laser focused on the disease, pulling back 50,000 feet and looking at the whole makeup of the person.
The Physician-Focused Payment Technical Advisory Committee, or PTAC, has backed 2 new alternative payment models and is recommending them to HHS. One model is an episode-based payment model in end-stage renal disease. The model targets the first 6 months of dialysis and was given a full recommendation. The other payment model was a capitated payment model from the American Academy of Family Physicians, which was recommended for limited-scale testing. Proposals that failed to receive recommendation from PTAC include an APM for the initial therapy of newly diagnosed patients with organ-confined prostate cancer, billing for annual wellness visits at rural health clinics, and a proposal for bundling maternity and newborn care. The first of its kind comprehensive companion diagnostic test for solid tumors, Foundation-1 CDX, not only provides patients with the ability to be matched with a therapy, but opens the door to development of new targeted therapies. Dr. Stuart Goldberg, Chief Scientific Officer of CODA, told the American Journal of Managed Care in an interview that the test marks a new era in precision medicine. He said, "What you're trying to look for is there a gene that is altered or mutated, and is that gene so-called actionable? Do we have a pill or targeted therapy to turn that gene off? And maybe by turning off that gene, you can slow down the progression of the cancer or maybe even put the patient in remission." The test also has potential benefits for patients with less common types of cancer and will allow doctors to refer patients for clinical trial participation if there are no therapies currently available and it is discovered that a lot of patients have a certain mutation. For the full interview, visit ajmc.com. Finally, for the past 2 weeks, AJMC's readers have been voting on what they thought was the biggest managed care story of the year. It was a close race, and the top 5 stories included President Donald Trump ending the Affordable Care Act cost-sharing reduction subsidies for insurers, and the Senate failing to pass the ACA repeal and replace legislation. But to see what story was voted as the most important for the year, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.